Hi everyone, today we are going to discuss about the second part of definition of pharmacology. In previous class we discussed what is pharmacology and what are the branches and the classification of pharmacology. Along with that, by previous class usually we discussed the term drug. So this also included in the definition of pharmacology. So before going to that we need to know what is drug. Any single chemical substance which can produce a biological response is a drug. It is a single active chemical entity present in a medicine that is used for diagnosis, prevention, treatment, cure of a disease. In previous class we discussed pharmacology means study of drug. So study of drug means in the name itself what we are studying regard drug. So we should know the definition of drug. So as usual early we discussed now. So that is the definition of drug. In that we see in diagnosis, prevention, treatment. Here the diagnosis how the drug will be used. For example, barium sulfate is one of the chemical moiety, chemical entity which is used to scan bones. For the prevention, corona and BCG vaccine, and treatment and cure, any medication which are usually using for fever, cold, cough, etc. According to WHO, drug definition also which is given by World Health Organization. According to that, drug is any substance or product that is used or is intended to be used to modify or explore physiological system or pathological states for the benefit of recipient. According to WHO, we have that it is a chemical moiety. It is used intended to be or normally we'll use, and that will be alter physiological and pathological state of recipient. Here recipient means whose the drug will be taken by patient. So pharmacology, which is broadly classified into pharmacokinetics and pharmacodynamics. As usual, in previous class we discussed. Simply pharmacokinetics means the movement of drug. Here that simple definition, what the body does to the drug. When we take one example, that is paracetamol. So in this pharmacokinetics we have four segments: absorption, distribution, metabolism and excretion. Here that when we take paracetamol, absorption orally absorbed fully, distribution 1 liter per kg, and metabolized in liver by glucuronide conjugation reaction and excreted through urine, that will be 5 ml per kg per minute. And the pharmacodynamics, the drug power, what the drug does to the body, and which will be alters physiological and biological effects. So what it should be, when we take one example, adrenaline, which will be interact with adrenoreceptors, thereby stimulation of adrenaline cyclase and thereby increase cyclic AMP and calcium concentration in the cell membrane. By that cardiac stimulation will be takes place. So these calcium ions are mainly responsible for the contraction of cardiac muscle. So cardiac stimulation will be takes place. So this is the alteration of physiological and biochemical effect by the drug. So I hope you guys what is the differentiation between pharmacokinetic dynamics. So pharmacokinetics means the movement of drug, dynamics means power of drug. So movements what we have discussed, absorption, distribution, metabolism and excretion, and the dynamics means what that physiological and the biochemical effect of the drug molecule. Thank you.